Polycystic ovarian syndrome is the most commonly occurring hormonal disorder in young girls and women of reproductive age. Women with PCOS may have irregular or prolonged menstrual periods or excess male hormone levels. Causes: researchers believe that high levels of male hormones prevent the ovaries from producing hormones and making eggs normally. Obesity and family history of PCOS are the most common factors involved in this polycystic ovary syndrome disease. Symptoms: irregular periods, absence of menstruation, excessive facial and body hair, hair thinning and loss, acne, obesity, high blood pressure, abnormal skin discoloration, stress, depression. Treatment: bone up on vitamin D and calcium. A case study examining 100 infertile women with polycystic ovarian syndrome found that those who supplemented a daily 1,500 mg dose of metformin, a medication commonly used to treat PCOS symptoms, with calcium and vitamin D saw improvements in menstrual abnormalities and other symptoms.